Hello, everyone. We are coming to you again with another Focus podcast. And of course, because of our social distancing, you don't see me, but we are very honored to have a guest with us today who is going to provide great information about the latest of what is happening with COVID-19. I'm very honored today to bring to you Jeff DeMars, who is a part of the Louisiana Healthcare Consultants, and he is an administrative consultant who has graciously joined us today to provide information on an area that I'm sure has been questioned a lot and been mysterious for a lot, because it seems to be where some of the movement started with COVID-19. And so we want to talk about our nursing homes today. And so please, Jeff, tell everyone a little bit about yourself and your years in service.
Sure. Hi, I'm Jeff DeMars, and I work for a company called Louisiana Healthcare Consultants. I'm the administrator consultant for 7 nursing facilities in the south part of Louisiana. And in more particular, there are 4 in the greater New Orleans area. And I help each administrator and their management team on a daily basis. And it has been quite interesting since COVID-19. How it surfaced with the nursing homes more than any other community or any other entity in the community. Most people ask why COVID-19 and nursing homes, why were they hit more than anybody else? There's various reasons. We'll start off by saying that there are 93 nursing facilities currently in the state of Louisiana that have had a strong impact with COVID-19. And that's out of 436 nursing homes and long-term care facilities throughout the state. Over 200 have died in our Louisiana nursing homes, and probably over 400 at this time, the last count that I took, have been positive with COVID-19.
We know that that population is our most vulnerable and are desperately in need of the loving people that do take care of them, like the CNAs. And of course, you have administrative staff and so many people involved in the day-to-day function of, a nursing home. And a lot of people just maybe don't know all that's involved in a day-to-day activity or the functionality of it. But I know along with the hard hit number of the patients is the concern for the workers, and really not knowing, I guess, all that they need to know to prepare themselves, because it came so quickly. You're having the equipment that you normally use, but then without knowing that you need to do something else, you're providing the same care that you normally do. What's been some of the precautions that have had to happen very quickly?
Well, immediately we started practicing social distancing as we're seeing it on the media. And most people don't understand why it's more nursing homes, and there are several precipitating factors for it being nursing homes. It was right after Mardi Gras, and on one of our first nursing home that had the first case, it was this gentleman that is a social butterfly, and he went with his family and his friends for the entire week of Mardi Gras. And then he came back to the facility, and the thing about it is, when I say social butterfly, he is literally all over the facility visiting and everybody's face. And so we were able to track and trend. That's how it evolved in that particular nursing facility. The good news is, though, since he was the first, he was our success story. He came back to the nursing facility just this past week, COVID-19 negative, and he made it through the battle. And that was a good thing to see.
Absolutely, and we definitely need to hear those stories as well, along with those that are not so pleasant. But I think that's the upside of the entire process, learning about how those that have survived, what did they do, what worked for them, and what can definitely be applied to those that are left to continue the battle.
Right.
So what do you say to people, I guess families and other people who are calling with concerns about your practices?
Yeah, what we do is remind them that the Louisiana Department of Health and Hospitals kind of is our gatekeeper of what nursing facilities do. So when we discover that a resident in a nursing facility is positive for COVID-19, we immediately activate the hospital, and we are mandated to send them to the hospital so they can be appropriately triaged and whether admitted or not admitted. But if they're positive for COVID-19 and they have the active symptoms, they are required to be admitted to one of the hospitals.
Now, is there another area that you are able to put patients who may be positive as opposed to still being in the general group?
We're still required to send them to the hospital, but
Mhm.
once we see active symptomology with COVID-19, especially if it was the roommate, might be an example of the person that was COVID-19 positive, what we do is we separate them and put them down a separate wing of the nursing facility. And so that way we can do medical isolation until we determine if they're COVID-19 positive or not.
Well, that's great. And of course, with the great workers that are there, and I'm sure you've had many questions come from the workers. How can we best continue to take care of them? What do we do to protect ourselves? And so many elements involved. How have you answered their anxieties and fears?
We have reminded them that universal precautions have always been there. It's just extended to the masks. That's the difference. We did everything else to minimize the risk of spread of germs or bacteria, but now the added feature is the mask, just to prevent it from being airborne,
And have you
COVID-19.
struggled, like most entities, with having enough equipment?
Yes, there's still a shortage throughout the state and including our nursing facilities, but there is a hotline number that you call with the Louisiana Department of Health and Hospitals, and you have to get your facility's name on there and how many masks you need, how many gowns you need, how many shields you need. And they do have a center location of where these protective equipment is in Baton Rouge, Louisiana. You may have to go get the items, but you know, you got to do what you got to do.
Yeah, absolutely,
Right?
as fast as you can, and it's probably working better than depending on, a government agent or somebody
Yes,
bring it down.
absolutely.
Do it yourself so it can
Yeah.
be done right. I appreciate that, and of course, for yourself, how have you managed being in this position, having to answer so many questions and even think about yourself?
Right. I'm considered classified, and my boss is quick to remind me of this, that I'm currently not an essential personnel. So my role is, besides communicating with them via phone, text, email, I actually, if I have to go to the facility, I deliver to, and they will not let me in my own facility because they're following the rules, and I'll deliver supplies, documents, or whatever I need to bring to them. But I also have my mask
Protective
right here
gear.
with me. Yeah.
Yes. Now, those that are essential, the administrators, those that have to actually go and be in the building, are they practicing the distancing, or
Yes,
what's their routine like when they
yes,
have to be there?
everyone has to practice social distancing, even the administrative team. Some of the administrative, actually most of the administrative team are also have a clinical background. So they've actually had to get their hands direct care on patients and doing patient care, because it's no secret the fear and the anxiety of the frontline staff, such as nurse aides and nurses, have either got sick or they quit because of fear and anxiety. So there's a shortage of staff. So our administrative team has had to go back to basics and provide direct care.
And I'm sure that looks very different to many people when they're not used to seeing them so much. But I think that it probably brings maybe an assurance
It
to
does.
the patients, the residents there, as well as everyone, knowing that everybody's a part of this
Yeah.
battle to make it a success and to really find a better outcome. And so, what's the mood like around there? Because everybody is basically in one building or one place, one area.
It is. For the first 2 weeks, it's been pretty intense. Um, the mood has been fear and anxiety and somewhat sadness because we've lost some residents. And sad to say, we actually lost some staff too to COVID-19. And it's a hard thing. But I always preach this to the administrators, is something called the integrated experience, meaning behavior influences behavior. And that's a powerful message. And I've asked them to keep in mind, we know we can't touch like we normally would, but let's spread out, smiles. Let's spread out, positive attitudes. And don't show your fear. Make that fear a productive thing. Turn it from something being not so good to something good. Make fear a productive thing. And it'll be catching throughout the facilities.
Absolutely. So I'm sure for myself personally, I know music is a great healer. And
Yes.
so I know that in nursing homes, that's one big thing that brings a lot of people together. So has there been activity
Yes. Yes.
that has helped the momentum?
Activities has been challenged more than they ever have with this pandemic. One of the things that I do on the side is I'm the activity consultant for the Louisiana Nursing Home Association. So literally, I am the only person that certifies the activity directors in our state. And so I've been bombarded with nursing home activity directors, emails and texts. Jeff, what do we do? One of the things that I did provide for all of them is that the National Certification Council for Activity Professionals put out 101 things you can do with just one person as far as leisure and recreational activities. And music is at the top of the list. I mean, we played music overhead where all residents could hear it. We provided individual iPods using infection control procedures and making sure that they had music too as well. The biggest thing was, and it's also very funny, is, it's no secret, bingo is always going to be number one activity in the nursing homes. Whether we like it or not, it will be. And so we've had to resort to like in-hall bingo games. A resident will have on their PPE and they'll get in their doorway, and the activity director's down the hall with the mic calling bingo. So they still even get their bingo during these challenging
I
times.
love that. Well, there's always creativity that
Yes, ma'am.
comes into play when we have challenging circumstances, and maybe we need some flags so that they can kind of throw up when it's their turn.
Absolutely. That's a good idea. I may
Yeah.
share that.
Yeah, I mean, it's amazing what can happen, and I think that's a part of life, the bittersweet side of everything. But a lot of, innovative things do happen because everybody's had to jump in and come up with answers very quickly for what needs to work. And so when you have all of these new terminologies, who's been that standout resident that said, you know what, we're going to make it, we'll be okay? Because I know you have, like you said, the social butterfly and those that just are that personality that everybody can depend on. So has there been one that said, we've been through depression, we've been through a lot, we didn't get to this age by accident?
It's what I call my seasoned staff.
That's right.
My seasoned staff have done this for a long time, as long as me, and I won't say how long that's been. And so, I initially started off as a nurse aide with many of the seasoned staff that are still working as nurse aides, and they're friends of mine. And so it's because of them and their strength and their wisdom and their knowledge and their experiences of going through major disasters and crisis situations and still holding themselves above water. And again, it goes back to that in the integrated experience, behavior influences behavior, and our seasoned staff are doing just that.
Good news to hear because so much has happened, and I know how have the families. I know they've been calling, but we've seen so many images of birthdays celebrated outside the window, the
The
babies.
window's a big thing. So we encourage the window visits. They are structured. We just want to make sure we're following the
Sure.
rules. But we've increased the social media with residents and families. And that has worked remarkably. We have a dedicated email line just for the families during COVID-19 where they can communicate with their loved ones. We're doing text messages. We're doing photo collages and making sure that their family get to see the photos and
Yes.
sending it to them. It's amazing. And we're doing FaceTime. The residents have learned how to do FaceTime.
I love
Yeah.
it. Well, technology has really made the difference, I think, in this effort for everyone to really stay connected and really discover what is working. So, going forward, what do you see as the future for nursing homes and how this has caused improvement and better practices?
It's going to be a new way of living. I've been through many disasters. I've been through the AIDS epidemic. I have been through the Lord knows how many hurricane disasters, and you just can't compare to this one because it's different. We've never experienced it before, but my belief is that a crisis is an opportunity of growth and change. So we should take this experience and learn all what we can if there is a next time. So we'll be a little bit more productive and not be so fearful and anxious next time.
Well, in my final question in all of this, with the up and the down of it, the ebbs and flows, what do you take away from this as your for your growth experience and how you reflect on everything that that's happened and what you have to do going forward.
The human spirit is very evident, and to me the human spirit is true medicine for everyone. And if we continue to treat each other with kindness and professionalism and respectful and caring ways, that we'll make it through any disaster.
Well, it has been a real pleasure to speak with you, and because that population, they have brought us through so much and gotten us to where we are today. And so I think, as always, they were here first and should be revered and honored and kept like you all are doing. So thank you for what you do. Congratulations. And I know that we look forward to the day when we can commemorate and celebrate those whose lives we want to remember, and those that survived, and how we become stronger together. So Jeff DeMars, thank you so much.
Thank you.